Greetings from Alcacho Territory, Anaheim Lake, BC. My research revealed that First Nations people in Canada are experiencing increased rates of several types of cancers, including colorectal cancer. My purpose today is to share with you the evidence of why this phenomenon is occurring, as well as evidence-based strategies to address this issue. The root causes of First Nation increased vulnerability, as discussed in the literature, include the historical injustices that have had a devastating effect on First Nations people. These include the loss of much of the First Nation traditional lands with first occupancy onto reserve land, the attempt of assimilation by the forced residential school attendance of First Nation children, and the alienation of the First Nations people from their culture and traditions. The loss of their land and cultural identity has led the majority of First Nations people into disparity, with higher poverty rates and less available traditional foods. Consequently, many First Nations people purchase cheaper, lower nutrient foods and have sought comfort in harmful substances of commercial tobacco and alcohol. According to the research, repeat exposure of the colon to extrinsic factors of nutrient-poor food and addictive substances has been linked to faster evolvement of colonic polyps into metastatic cancer, as seen on the slide. High-quality systematic reviews reveal that colorectal preventative screening have a high rate of success of preventing more invasive cancer. However, First Nations people were found to have lower participation rates for colorectal screening. Barriers for screening outlined in the literature included mistrust of healthcare systems, lack of awareness of colorectal cancer risks, and lastly, challenges with accessing screening services, as the majority of First Nations people live in remote areas. The research indicated 4 evidence-based strategies to decrease cancer rates within First Nations communities. Number 1, establishing trusting relationships between healthcare professionals and First Nations people to allow for therapeutic exchanges to occur. Number 2, providing culturally specific education that increases the awareness and understanding of colorectal cancer and the use of preventative screening. Number 3, designing of First Nation specific registries to enable the capturing of all individuals screened, as well as those at risk due to lack of screening participation. Number 4, enlist First Nations persons as patient navigators to outreach their fellow community members of identified risk and provide assistance in accessing preventative screening. The strategies I just outlined were included in the Aboriginal Cancer Strategy 2 plan detailed by Cancer Care Ontario. Similar strategies are being embraced by my employer, the First Nations Health Authority in BC. As a rural remote nurse, I see the importance of utilizing these strategies in the work I do to help decrease colorectal cancer rates.